let's go on and talk about COVID-19. Thankfully, we're dealing with something that's more like a 2% mortality. However, we know that it's much higher for the elderly and those with chronic illness. The risk of long-term or serious complications is, higher than 2%. So people are dealing with chronic fatigue, chronic diarrhea. People are in the hospital with blood clots. People have become cardiac cripples or long-term breathing problems from COVID-19. And although I'm pretty healthy and relatively young, I'm going to take this vaccine because I don't want to risk this. And as you may have heard in that little history lesson I gave you, while the average mortality from smallpox was 30%, among Native Americans, it could be much higher. And in fact, we are seeing a higher mortality with COVID-19 in our Alaskan Native population. So when you play the game of, what's my chance of dying, of course, it's just statistics, but it's not always a simple number because your own individual risk can vary from person to person. Now, I'm really thankful about the vaccines. I've heard a lot of concerns about the fact that it's an emergency use authorization. So these vaccines have not been fully FDA approved, but I'd like to remind everybody that's the same for our Abbott machines. We have a lot of scientific data that says our Abbott machines are good, and we have a lot of scientific data that says that these vaccines are good. So I want to say first, no steps in the development were skipped. In other words, we started with a few volunteers getting the shot, and then we had a few hundred volunteers. And then in the phase 3 trial that approved the Moderna vaccine, we have 30,000 people in that trial, and it's an ongoing trial. They are still being followed. Now, the current data is only for about 2 months, but we do know that at 2 months, if you got 2 doses 4 weeks apart, it was 94% effective. And just to show you that, here is the actual data that the FDA used to evaluate it. And that red line is the people that got the vaccine. And you can see almost nobody, it's right there almost at 0. Each day, very, very few people in the thousands that they were watching got COVID. But the blue line is the people that got randomized to a placebo. So in this study, nobody knew who got the real vaccine and who got the placebo, but they gave you a number, and then they watched what happened. And the people that got the placebo, as you can see, each day, a few more people got infected. So we want to know about safety, right? So we know it's effective, at least in 2 months. And in a few more months, we'll know more about how long that effectiveness lasts. But we want to know about side effects, right? If you've been watching the news at all, then you've seen that there's been concerns about side effects. And in those 30,000 people that were studied, it was pretty common to get some mild symptoms. So arm pain, a little bit of swelling or redness where you got the shot, generalized achiness and fatigue, pretty common. So we want you to know that there are side effects from the vaccine. And we do expect to get a delivery of the Moderna vaccine here in the next few hours. So this is not just a theoretical talk. Those of us who are in healthcare are up to get this vaccine. And I was very tickled to read the study that said there was no anaphylaxis in those 30,000 people who were studied for the Moderna. Now, I said healthcare workers. That brings up the next question, right? Who is going to get this vaccine? Well, first of all, let me reassure everybody that I checked with the state, I checked with ICS. Nobody is planning to mandate this or require it. The state of Alaska is distributing the vaccines, and they decide and tell us, this is the group that gets done first. And so who's been picked is healthcare workers and nursing home residents. Now, we don't have nursing home residents out here in Glen Allen, but we will be offering, and in fact have passed out the consents already to primary care, to COVID teams, our health aides, and our first responders who are up to get offered this vaccine. Now, the state is meeting this week to decide the next group, and we don't know because they're the ones that get to decide, but probably those at risk for complications and dying are up next. And so we hope that we can then offer it very quickly to our elders and those with chronic illnesses. And they expect also some more essential workers will also be available. It will be available for them as well. So those are all the things I can think to tell you about, but I expect that people also may have some questions.
I didn't have any questions submitted via email. The chat is open if you want to submit questions via chat. I think something to touch on is pregnant and nursing women and children.
Okay, excellent. Okay, thank you. So Melanie is just reminding me, what about children? So this vaccine the Moderna vaccine has only been approved for ages 18 and older. So we cannot give it to children. Fortunately, the risk of children getting complications from COVID is extremely low. So we will wait until we have more data on children getting the vaccine. We will not give it to children at this time. So pregnant and breastfeeding women, they were not specifically studied. However, it's an individual decision. So the CDC has come out saying, because there is a slight increased risk of COVID complications in pregnant women, that they do suggest that probably the risks of COVID outweigh the theoretical risks of the vaccine. But it's an individual decision, and they basically recommended that women who were pregnant or breastfeeding talk with the provider.
Okay. A question that came in is, what is the mortality rate for our elders? What is the percentage for the long-term effects you mentioned?
So I'm not sure exactly, I could say for our elders. What we know is that the mortality among Alaskan Natives was 1.8 times higher than somebody else who was non-Hispanic white. So if, And it depended on age. When I read the data, they said if you were younger, it might be 10 times higher. So if you were, say, 30 years old, Alaskan Native, you might have 10 times the risk of dying as somebody who was white, non-Hispanic, same age. That is not as dramatic as you get to our elders, but it is still a little bit higher than the average mortality for white people.
Okay. And maybe an average or a percentage for long-term effects you mentioned. So if you choose not to get vaccinated, what is the percentage that you would suffer from long-term effects?
I do not have that number, but I will try to get that number.
Okay. Next question. I'm going to speak a little louder so everyone can hear me. What do we know about how effective it is on different strains?
So I was actually listening to a scientist last night who, obviously these vaccines are very new. So as far as formal data to be able to compare effectiveness on the various strains, we don't have that. What we do have is that 30,000 people, were in the study and it was 94% effective. What the scientist was saying is that these mutations take time to change that spike protein. So the vaccines work on the spike protein that allows the virus into our cells. And that spike protein can't change very quickly, or it doesn't get in our cells. And so we don't know exactly, but he seemed to think it would probably take 5 years for the virus, the coronavirus, to mutate enough that it would affect the vaccine effectiveness. So that is why it would, these vaccines might need to be tweaked, but it shouldn't affect our effectiveness here in the next couple of years.
Short term.
Yes.
Okay. Are certain blood types less susceptible to the virus?
I am not aware of anything scientific about that.
It's all too. Okay. A couple of questions regarding allergic reactions to the vaccine. Has there been allergic reactions to the vaccine? A couple cases of anaphylaxis reported in Alaska. Are we addressing this concern? And then, is there a process in place for patients to rotate in and out of the clinic with little to no contact with each other and still have the appropriate time to be monitored for negative reactions?
Excellent, excellent. So first, let me say that yes, all our standard precautions for protecting patients will be in place. So we will stagger it so that everybody, will not be crowded into a waiting room, and people will be monitored for a minimum of 15 minutes after their vaccinations, just like we do for all vaccinations. And the anaphylaxis reports have been with the Pfizer vaccine. We may eventually get the Pfizer vaccine, but for now, the state has told us that since we requested Moderna is what we're going to get for the next couple of months anyway. I suspect that eventually, I'm not suspecting, I am sure somebody will eventually have an allergic reaction to the Moderna vaccine, a serious anaphylactic reaction. However, that happens with all vaccines. We unfortunately have to be ready for that, and we are. We have EpiPens, and we have Benadryl, and we have everything ready in the clinic, actually at all times, because we know this could happen from a flu vaccine. We know it could happen from a tetanus shot. And speaking of tetanus shots, I don't know if any of y'all have had reactions to immunizations before, but I know some of you have, because you've told me, hey, I don't want a tetanus booster today because I've got something to do tomorrow and I don't want to feel sick. And that, I just want to say that is a sign that the vaccine is working. That is how vaccines work, is that they stimulate your immune system to create antibodies and what we call cellular immunity. So when your immune system revs up, it makes you feel often a little sore. It makes you feel a little achy, maybe a little tired and headachy. These are all normal reactions to vaccines, and they usually occur in the first few days. And with the Moderna vaccine, they were almost all gone by 7 days. Some people took Tylenol, and that's exactly what I intend to do.
I think you answered some of the other questions that have come in. Do we have the ability to treat a severe anaphylaxis response while waiting for a medevac? You kind of touched on that. Someone asked, what kind of allergic reactions did the 2 Alaskans experience? I think you mentioned that from the Pfizer vaccine.
They were, yes, anaphylaxis from the Pfizer vaccine.
And then jumping back, there was a question about people being vaccinated if they have cancer or diabetes.
So those are high-risk patients. Those people who have diabetes, heart disease, cancer, chronic steroid use. There's quite a long list, but we are compiling a list of patients with these diseases so that once we get the green light to vaccinate our higher risk patients, these will actually be patients that we offer the vaccine to earlier because of the risk of getting complications from COVID.
And then Dave did share a website for learning more and making decisions about the vaccine.
Excellent. Is that the one from the CDC?
It looks like it's from Moderna.
Moderna, okay, excellent. And I will say, because this is an emergency use vaccine, instead of just getting the usual one-page vaccine information sheet that you're used to getting when you get a flu shot or one of your kids gets a childhood immunization, it will actually be a 4 or 5 page explanation of the vaccine. So you will, those who are considering this vaccine, there is definitely information in a written form to give you.
Okay. We only have a couple more minutes, but can you just briefly touch on it being a 2-part vaccination and what that means and what
Sure.
it looks like?
Excellent. And I think this makes a lot of sense to me, because all along we've been wondering how is this vaccine going to work if it is possible to get the COVID virus infection a second time? The answer to that is you do build up immunity from one exposure to the virus, but you build up a lot more immunity when you get a second exposure. And so in the case of the vaccine, you're not being exposed to the virus. These are not live vaccines. You cannot get COVID from the Moderna or Pfizer or vaccines. None of these vaccines that are being developed are, that I'm aware of, I know for a fact, Moderna and Pfizer are not live vaccines. So
Live viruses.
live viruses, they are not live. So you can't be infected. Instead, they actually give you a little piece of an RNA genetic code that tricks your body's protein factories into making little bits of virus. In fact, it's the spike protein that you make. Well, I was going to show you. Those little red cauliflower looking things are the spike proteins, and your body gets tricked into making those, and then the rest of your immune system takes one look at those and says, that's not right. They start building up antibodies, cellular immunity, and then 4 weeks later, we give a second dose. Your body makes more of those proteins. Your body responds even stronger, which I think it's only fair that people hear that after the second vaccine, the immune response is stronger, so you tend to have more of the achiness, more of the sore arm. That's just the way it is, because your immune response is stronger, and that's why it works better than just getting the COVID disease.
So if you have already had COVID, it's still necessary to get vaccinated?
They are recommending getting vaccinated. That is true. Now, because there's such a limitation on how much vaccine we have right now, the CDC said, hey, if you just had COVID, 3 weeks ago, maybe you should let your coworker who's never gotten it, get in line first. And you maybe could be, a month or two out getting yours, because we do feel like one infection protects you for a few months. And so, but yes, as a matter of fact, we are recommending it for people who have already had COVID.
A couple more questions have come in. What is the risk of infertility of this vaccine on women?
I do not know, because that has not been studied. I have never heard of any vaccine causing infertility, however. So I don't think that's a significant concern in the scientific world.
And then you spoke about how we have Moderna coming. Can you speak as to why we chose Moderna or were assigned Moderna over Pfizer?
Sure. That's actually pretty easy. Pfizer has to be kept super, super cold. And if you can't keep it at negative 70 degrees Celsius, which almost nobody can, then you have to use it within 5 days. And those 5 days count your transportation. So it would be 5 days to get it from Anchorage and to give it to people. And that logistically was going to be tough. And also because of the temperature issues, there was a lot of complication about how you gave it. And while we know we can do this, we looked at the Moderna, and logistically, it's going to be a lot easier to give it to people. And so we went with Moderna.
Can you speak to the efficacy between Pfizer and Moderna? Is one more effective than the other?
Very, very similar. In the studies, Pfizer was 95 point something percent, and Moderna was 94 point something percent. So with almost identical.
Okay. Just a reminder, if you have questions after the chat, you can submit them to info@crnative.org, and we can look at addressing those questions during the daily brief or directly emailing you back. So we got a lot of thank you, Dr. Robinson.
Thank you.
You did a very nice presentation.
I appreciate the chance to talk.
All right. Thank you, everybody. Have a good morning.